أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by HAJJ Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Today is the first episode in a three-part miniseries entitled Hajj and Health Issues. And our topic of discussion today is the influence of the swine flu on Hajj 2009. The influence of the swine flu on Hajj 2009. Our guest today is Dr. Gamil Tourky, who is Director of Preventive Medicine and member of the HAJJ Medical Mission for the Sharjah Medical District. Dr. Gamil, assalamu alaikum.
Assalamu alaikum.
Welcome to Medicine and Islam.
Thank you.
We're happy to have you, and Dr. Gamil will be here for the next 2 weeks, and he will complete our three-part miniseries. First of all, of course, you know, the swine flu has become a worldwide epidemic now. And naturally, the Hajj being the largest gathering of human beings in the world is a concern. So before we talk about the Hajj and how the swine flu affects the Hajj, let's first hear from you exactly what is the swine flu and how does it differ from other forms of the H1N1 virus?
In the name of Allah, the most merciful, most beneficial, swine flu is now a pandemic, which means that it is occurring in many areas in the world, affecting many countries. And as by the definition of WHO, pandemic means the occurrence of a disease in epidemic form in more than 2 continents of the universe. Swine flu started, as many viewers know, in Mexico. Then it spread to the United States in Texas, California. Then it spread to Canada, and then later on to Australia and Europe. And from there, it spread to many countries in the world, especially in these days with the magnitude of travel and trade occurring between different countries. It spread, and it is now called the first pandemic in the 21st century.
Subhanallah.
Yeah.
Subhanallah.
Swine flu, the beginning, the disease was called, or the pandemic was called swine flu, but later on it changed to influenza A H1N1. Because it is not merely a swine disease, although swine flu H1N1 is endemic in swine. But what happened is this is a novel virus which starts to spread from the swine to humans and from humans to humans, and this is the big concern now. It is spreading between human beings, and the spreadability of the disease is very high compared to the seasonal influenza. This is a novel virus actually, and with novel virus the human beings don't have any immunity against it. So this explains the great spreadability of this disease. And this disease mainly affects the upper respiratory tract, and it is manifested as a disease which occurs with some signs and symptoms like fever, usually exceeding 38.8 centigrade, and headache, cough, dry cough, sneezing, runny nose, body aches, and in 20 to 25% of cases, it is sometimes manifested with gastrointestinal symptoms like diarrhea and vomiting. The symptoms more or less, mimic the symptoms of the seasonal flu. That's why, it is almost difficult to differentiate between the seasonal flu and the swine flu in terms of the clinical,
What
manifestations.
about eye involvement?
Yes, sometimes the eye is involved and, congested and,
Conjunctivitis.
Yes. Yes. These are the cardinal symptoms of the disease. The majority of the cases are cured even without treatment.
Exactly.
And the case fatality is very low compared to seasonal influenza. It is almost less than 0.4% but in influenza it is much higher, almost 10 times more than the swine flu. And if we compare it with the bird flu, it is almost 100 times, compared to the swine.
Avian flu.
Avian flu, compared to the swine flu. If there are some people who are at high risk for this disease, and actually this is a big concern, because from the data available so far, and from the studies conducted, we found that people who are at high risk are young age groups below the age of 5 or elderly above the age of 65. And also people with chronic medical conditions like bronchial asthma, like emphysema or COPD, diabetes, chronic renal disease, chronic liver disease, people who are immunocompromised due to HIV infection, or they are on immunosuppressive drugs like corticosteroids and cytotoxic drugs. So these people are...
What about pregnant women?
Yes, pregnant women also as well. Are at high risk.
A lot of pregnant women are dying.
Yes.
They also, the immune system is compromised.
Right. Because pregnancy itself, poses some problems in terms of lowering the immunity. And many women also have some gestational diabetes during pregnancy. All this put women at risk, also for the swine flu. This is basically, the signs and symptoms of the disease. And in some cases, it can develop to lower respiratory, infection, and it can lead to pneumonia sometimes. It can affect some other organs, and it can lead to multiple organ failure and death. So we don't want to panic, or overestimate the problem of swine flu, but at the same time we have to be also careful, and take whatever precautions, and don't underestimate also the magnitude of the problem of this disease. When it comes to HAJJ, it is a unique situation. As you know, many people come from different, parts of the world, many nationalities, many educational backgrounds, many, different socio-economic, status, many, different habits, So, and all these factors, when you see the gathering of more than 3 million people at a time in a localized area, either in Mecca or in Medina or in Mina, this can pose a risk, because of overcrowding is also a problem. And we all know, in the past we used to hear some terms like Medina influenza. People who used to go to Medina, usually they started to suffer from upper respiratory cough and sneezing. And there is nothing called Medina influenza. There is no strain called Medina, strain. But this has been, circulating, among pilgrims, So the uniqueness of the HAJJ situation, the overcrowding, and also the physical activity of the HAJJ during this, journey, sometimes can pose some risk, and it can facilitate, the spread.
What about how effective are the preventive measures, like the wearing of masks and frequent hand washing?
Yes.
Can they help?
Of course, yes. When it comes to the, prevention of this disease, usually we say prevention is better than cure.
Yes.
And sometimes the prevention is the best cure or the only cure available.
Yes.
So we have to take the precautionary measures, when going to HAJJ. Hand washing and personal hygiene is very important. As you know, hand washing with just water and soap can kill up to 90% of the germs, attached to our hands, and which can get into our, respiratory tract or gastrointestinal tract, and can cause many problems, health problems.
And the liquid antiseptics you're using kill up to 99%.
Yes. As extra thing we can do, we can use these sterilizers, or we can use alcohol-based, hand wash, which can be more efficient. But at least we have to keep the habit of hand washing, regular hand washing with soap and water at least.
I read an article just this morning that mentioned from America that I recommend a minimum of hand washing 10 times a day. Coming out of the toilet, before and after eating.
Yes. Alhamdulillah, we Muslims are blessed with our, ablution.
Extension wudu.
Yes. And before we go to prayer, we have to do hand washing, face washing, so at least we have, 5 times obligatory.
Yes, absolutely. It's the barakah of the sunnah. Yes, absolutely. Yeah. Very good. Now, how do you treat the swine flu? Once you, say God forbid that you contract the disease, what is the treatment?
Yes. Before we get into the treatment, I would like to go quickly over the diagnosis of swine flu.
Okay, fine.
Because many people may ask about, I have a flu and I'm afraid that I have the swine flu. Actually, in the past, we used to have some criteria for the case definition of a swine flu. And at the beginning of this pandemic, we emphasized the importance of people coming from infected areas. So the history of travel was very important in making the diagnosis. Also, the history of close contact to a case which is confirmed by laboratory tests. But nowadays, with the spread of the disease almost everywhere in the world, and from the studies documenting that the most common circulating virus at this moment is H1N1 influenza. So now we are treating any case of flu-like illness as if it is swine flu until proved otherwise. This is basically the clinical grounds of making the diagnosis, especially at this time.
This is coming from WHO,
yes, these are WHO recommendations, also CDC recommendations. The the Center for Disease Control.
So if you suspect it, don't test it, just go straight to the
treatment. In the past we used to
faster.
In the past we used to do what is called the quick test. So it is a test which can test for influenza A. It doesn't differentiate between influenza A due to swine flu or influenza A due to seasonal influenza. And actually this was misleading, and some physicians sometimes misinterpret the result of this rapid test, and the delay in the initiation of treatment can cause problem. Because the treatment is very effective if it is initiated within the first 24 to 48 hours.
Yes, I read that, yes.
So if it is delayed, it is still effective, but it is not that effective like if it is initiated early in time.
Two of my children got sick last week. I have a 12-year and a 14-year. Both of them came out with symptoms. And the internist at Royal Hospital, he told me the WHO new criteria. And they went straight for the Tamiflu within 24 hours. And within 2-3 days, they were back to school.
Exactly. This is our guidelines now. When we have suspicion based on clinical grounds, we just start the treatment. And for some cases which are admitted to the hospital for some severe conditions, or if they need intensive care, we do the confirmatory test by PCR test. It is a bit sophisticated test. It takes some time because we have to, laboratories in the United Arab Emirates. Both laboratories are in Abu Dhabi, Sheikh Khalifa Hospital Laboratory and Zayed Hospital, the military hospital laboratory. We send the sample over there for confirmatory test by PCR. It takes time.
In the meantime, the patient is sick.
Yes. So the policy now is we have to start the treatment as quickly as possible, as long as the case is highly suspicious.
Very good. Now, how has the swine flu changed the guidelines for the HAJJ? Now, the treatment, of course, we just mentioned Tamiflu.
But the treatment available now is what's called the antiviral drugs, like Tamiflu and Relenza, another drug. Tamiflu is in the form of capsules. It is taken for adults 75 milligrams twice daily.
For 5 days.
For 5 days. And Relenza, it is by inhalation. Yeah, it is inhalation, drug. And both drugs are very effective.
Very good.
Although some reports recently have showed some drug resistance for these two drugs, which is a big concern for us at the moment. But it doesn't reach a level where we can be anxious about it.
I understand.
Yes. Yeah.
Okay.
When it comes to Hajj,
yes.
Yeah, actually, as we discussed earlier in the program, during the Hajj there are 3 million people or more coming from different areas in the world, from different backgrounds, performing heavy duty, kind of physical activity, and some people are elderly, some are having some chronic conditions, hypertensive, diabetics, renal disease, liver disease, heart disease, so many people at risk. So actually this constitutes a challenge. And with the overcrowding also, it will add some risk.
Right, and because of that, Saudi has made some new rules,
yes.
right? What are the new rules about the Hajj that have changed from before?
Actually now they started to restrict those who are below 12 years or above the age of 65.
Below 12 or above 65?
Yes. And also people with chronic conditions.
Okay.
And pregnant women as well.
Okay.
And also they require that any Hajj going to Saudi Arabia should conduct medical screening before going to Hajj.
Okay.
And this is actually an advice we would like to give it to every Hajj.
Okay.
Before going to Hajj, even if you are healthy,
medical
you
screening.
have to go and
that was going to be my last question. We're just about out of time. The last question would be, what recommendations has MOH made based upon the Saudi rules and regulations? What recommendations do you have about the people going to Hajj in general? Yes. What are those recommendations?
In the United Arab Emirates already we conducted 2 seminars for the organizers of the Hajj campaigns, Hamlas.
Okay.
And also we organized 2 seminars for the doctors,
very good.
Who are going to supervise, these Hamlas.
Very good.
Okay, so they are aware now and oriented about, the disease and also about the instructions of the Ministry of Health. We emphasize the importance of, personal hygiene of the Hajj, also the environmental hygiene of the place where they are living, either in Mecca or in Medina or in Masha'ir area, in Mina, Arafat. Also we instructed the doctors joining, the Hamlas about the procedure of notifying any suspected case, so we can conduct the epidemiological surveillance to make sure that the case will not spread to other people. Also, we asked every Hamla to designate an isolation room for in their residency facility in the hotel. So whenever there is any Hajj, suffering from flu-like illness,
they get isolated.
They can just stay aside in this room, wearing the mask, and also the Minister of Health is making the logistics for ensuring that these personal protective, equipment like the gloves, masks will be available. So whenever we need it, we will, use it. And also we have inventory for the Tamiflu, for the antiviral drugs. So people, when they are sick, they will not, have any hard time looking for a pharmacy to buy the medicine from. Or so they will,
Why don't we do one thing, because we're just about out of time. You're going to be back with us for the next 2 weeks.
Inshallah.
So in the next program, we're going to start off where we left off and talk more about the Hajj and the various recommendations and rules and guidelines and medical treatment, because this is what people really want to know about.
Okay.
And we're out of time now. We want to thank you, Dr. Gamil Tourky, for coming. Viewers, Dr. Gamil will be with us for the next 2 weeks. Please stay with us throughout this 3-week coverage of the Hajj and health issues. And we thank you for reviewing. We always entertain your comments and questions. You can write me at Medicine Islam, P.O. Box 111, Sharjah Television, Sharjah, UAE. Or you may send me a fax at 9716-5311969. Or as most people choose to do, you may send me an email at medmanuae@eim.ae. And as our custom on Medicine and Islam, we'd like to conclude all of our programs with a short dua and short prayer of the Prophet Muhammad, peace be upon him, such that if any errors or mistakes have been made on this program, and most importantly, if any sins have been committed on this program, that Allah subhanahu wa ta'ala in His infinite mercy and grace will forgive us. Subhanallahi wa bihamdihi, subhanakallahu wa bihamdika, wa nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk. Jazakumullahu khairan. May Allah reward you with the very best Islam. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Today is part 2 in our 3-part miniseries entitled Hajj and Health Issues. The topic of today's discussion is medical preparation for Hajj. Medical preparation for Hajj. Our guest is Dr. Gamil Tourky, who is Director of Preventive Medicine and member of the Hajj Medical Mission for the Sharjah Medical District. Dr. Gamil, assalamu alaikum.
Assalamu alaikum.
Welcome back. You were with us last week for our first episode, and you'll be with us next week as well to finish our 3-part miniseries. We welcome you back. Of course, at the end of last week's program, we were talking about the special rules and regulations and guidelines for the Hajj of 2009 and how the swine flu has affected those things. You were in the middle of explaining everything, but we ran out of time. So before we go into today's topic, can you briefly summarize the new guidelines for Hajj for our viewers that did not see last week's program and finish whatever else you wanted to complete, but you didn't get a chance to complete last week? Please.
Okay.
Tafaddal.
Assalamu alaikum. Actually, last week we discussed the guidelines for the Ministry of Health, how to deal with this swine flu pandemic situation during the Hajj season. And the Ministry of Health, in the United Arab Emirates, in collaboration with the Ministry of Awqaf, also in collaboration with the Awqaf Ministry in Saudi Arabia, has put a plan to, deal with this, challenge during the Hajj season of swine flu or H1N1 influenza. And this year, a mission from the Ministry of Health and Awqaf from the United Arab Emirates went to Saudi Arabia and inspected the places where the Hajj will stay during their Hajj season, to make sure that it will be appropriate and suitable, especially with this new development of this disease.
The hygiene becomes more important now.
Yeah. And this year, there is a requirement from all the Hajj Hamlas to designate one room for their Hamla. This will serve as an isolation room. Okay. So whenever anyone suffering from flu-like symptom, he will be isolated in this room and seen by the doctor joining the Hamla. And whenever he needs transfer to the hospital, he will be transferred to the hospital, and the case will be notified to the Ministry of Health for further follow-up.
Okay.
And the medical mission for the United Arab Emirates during the Hajj also has reserved a 200-bed facility in Mecca.
SubhanAllah.
Yeah, and this is for the worst scenario in case of, many cases are reported. So still we have the,
Where is that facility?
the logistics in very close to the Hajj, the medical mission building.
Okay.
In Mecca. In Mecca. Also the same thing also was arranged for Medina, and the same thing also was arranged in Mina and Arafat.
Okay.
So people will not be prevented from conducting, their
the worship.
The worship part, but at least for those who are suffering from, flu-like illness, they will be separated from the rest of the pilgrims.
So they can be even on Arafat, but in a facility.
Yes.
Oh, that's nice.
Yes.
That's nice.
Actually, this was conducted and was done with the guidance of our political leadership, who are offering the Minister of Health all what is needed in terms of to make the arrangements and the logistics, so the Hajj will be hassle-free, inshallah.
Very good.
Inshallah.
I was concerned about that because the Prophet, peace upon him, said Arafat is Hajj. So if you miss Arafat, you technically missed Hajj. So if you make Arafat, even if you're sick, then you still have made your Hajj.
Yes.
Yeah.
Actually, every Hajj will be able to conduct, his, worship, even if he is not feeling well.
Very good.
And a special arrangement has been done in terms of the accommodation, in terms of the transportation, in terms of the treatment. Everything is arranged. So, inshallah, people will complete their,
That's great.
Hajj.
That's great.
And may Allah accept their,
that's very nice.
Their Hajj, inshallah.
That's very nice. SubhanAllah. Now, what about turning now to the Hajj itself and away from the swine flu? What about the importance of physical fitness?
Yes.
Okay, you touched on it briefly last week.
Yes.
Let's talk a little bit more about that.
Yes. Actually, we advise all pilgrims going to the Hajj to go to their family doctor or to the primary health care centers and do a medical checkup. During this medical checkup, physicians will, make sure that the Hajj is not suffering from any chronic disease, or if he is suffering from any chronic disease, his disease is under control.
Yes.
Because this is important to put any disease under control. If it is hypertension, if it is diabetes, if it is any other disease, at least it has to be under control.
Yes.
And also, we advise the pilgrims to take enough medicine with them. So they will take the medicine. Although the medical mission in Medina and Mecca providing all the medical equipment and also the medicines.
But you still should have your personal medicine
but
with
still,
you. Better.
Every Hajj, he knows his medicine. And he knows sometimes the dose differ, so he knows exactly how many tablets he has to take.
I read one article that said that they also recommend that in addition to the medicine, they take a copy of their prescription.
Yes.
In case they lose their medicine.
Right. Not only the copy of the prescription.
Yes.
We recommend and advise Hajj to take a medical report. If they have medical reports,
very good.
Yeah, if they have the medical reports, they can take it, because sometimes the Hajj can go into some problem.
Right.
And sometimes it is very important to have these reports.
Absolutely.
So the treating physician will know
everything.
Yeah,
he needs to
everything
know.
about the problem, and this will help a lot in terms of speeding the time for any intervention or
absolutely.
Yeah, making the medical assessment for the the case. Yeah.
Very good.
So also we advise Hajj. Actually, the Ministry of Health also has prepared what's called a Hajj card This card has all the information about the medical condition of the Hajj, his name, his blood group, his comorbid conditions, if he is suffering from chronic disease, if he is suffering from any allergies,
his diagnosis, his medications.
Yes. In addition, also we recommend that Hajj, before going, during this medical checkup, they will take the vaccines which are required as per the instructions
that was one
of the
my
government
questions.
of
What are
Saudi
the
Arabia.
mandatory vaccinations?
The mandatory vaccinations are the meningococcal vaccine against cerebrococcal meningitis, and also the seasonal influenza vaccine. Currently, the swine influenza vaccine is not ready yet, but if we have it before the Hajj season, it will be given.
So now the regular flu vaccine is mandatory now?
Yes, we recommend it, yes.
It didn't used to be, right? It used to be just meningitis, right?
Right.
Before.
Meningitis actually is the main mandatory vaccination. But during this season, we recommend also
the flu vaccine.
Flu vaccine.
Now, the people coming from Africa, they also have to get yellow fever.
Yes.
Right.
Yes.
Yes. So this is this program is aired all over the world. So if you're watching this from Africa, you also have to take yellow fever.
Yellow fever vaccine.
It's mandatory.
Mandatory, yes.
For Africans, yes.
Yes. And one thing regarding the vaccination, we advise pilgrims to take their vaccination at least 10 days to 2 weeks prior to travel to the Holy Land. Because usually this will give time for the immune system to be boosted, and it will reach to a level where it can offer immunity when we are in a situation at risk to contract any of these infectious diseases.
Plus, immunizations sometimes have a few side effects too, like fever and pain and so forth.
Alhamdulillah, all these vaccines, from our experience, are complication-free. It is only just a local reaction at the site of injection. Maybe fever, which is a very low-grade fever, for 1 day or 2 days, but no major complications. No major complications. But it is, a well-taken point, in terms of even to avoid any, side effect from the vaccine.
You don't want to travel like that.
And we can travel with our health intact. Yes.
Very good. Now, what about the potential carriers of meningitis? Because I read also that even if you get the vaccine, you can still become a carrier.
Yes, exactly.
So before you leave the kingdom, this one article recommended that they give them Ciprobay, 500 milligrams, before they return home. To make sure that they're not, because you can bring meningitis back home to your wife and children and neighbors and co-workers and classmates. Yes.
When we take the vaccine, this will offer us immunity, so we'll not get the disease. But still we can be carriers. And the carrier state can exist among like 5 to 10, sometimes it can go up to 25% of the population.
That many people?
Especially after Hajj and this gathering and the close contact with many people.
Repetitive
and
exposure.
we can have this microorganism, the meningococci, in our nasopharynx.
SubhanAllah.
Yes. So we can be carriers. And when we come back from the Holy Land after the Hajj, we can pose risk to our beloved ones.
Absolutely.
Especially with our Arabic habits of hugging and kissing. This can pose a risk.
I have news for you. The Arabs are not the only ones that like to hug and kiss. Americans and Western people, we also like to hug and kiss.
During these days, we advise people not to,
absolutely,
just to give up this habit for this time.
Temporarily.
Maybe, temporarily.
Yes, absolutely.
But, as we can be carriers after Hajj, even we received the vaccine, so it is important to take what's called chemoprophylaxis. And this chemoprophylaxis will abort the carrier state from the nasopharynx, and we will protect our beloved ones.
Right. This is what a Cypro comes
yes.
in. Yeah.
And the medical mission during the Hajj distribute this medicine, chemoprophylaxis, which is Cypro 500 milligrams, taken once.
Right. One dose.
2 hours, yes, one dose. 12 hours before departure from Saudi Arabia.
Just before you leave.
Yes.
Exactly.
Yeah.
This is what I read.
So this will ensure that the carrier state is not existing anymore.
And, before this year, I never heard that before. I did some research about the Hajj last year, and I first ran across it. But before last year, I never heard about the Cypro, and it's very important because you're safe, but you go home and you can infect a lot of people.
Yes.
Yeah, I didn't know that.
In addition to this, we have a registry for all, pilgrims.
HAJJ.
And usually the preventive medicine department is following up the Hajj after they come back.
Right, very good.
And usually we instruct them, and this is actually important. I would like important advice I would like to convey to our brothers who are going to Hajj. Even after they come back, if they feel any symptoms, after they come back, they have to report to the nearest healthcare center or to the preventive medicine department, because it may be the early sign of meningococcal disease.
Where are you located in Sharjah?
In Sharjah, we are located in Ghubeiba area.
Ghubeiba.
Yes.
Okay.
And during the Hajj season, we are opening from 7:30 in the morning till 8:30 in the evening.
SubhanAllah.
Yes.
Very good.
And we will be offering the vaccination free of charge to all pilgrims. And also we'll provide them with the health education messages with some booklets, some brochures, and the new guidelines for this season.
Very good.
Yeah.
Alhamdulillah. What about the other immunizations that are recommended but not required, such as hepatitis and A and so forth? I mean, what group of people need to get those as well?
Yes. Actually, these are the required vaccination. But we usually advise, the community at large and pilgrims in particular, to take whatever vaccines, available, because vaccines, is considered an intervention for primary prevention. We will prevent the disease from occurrence.
Right.
And also, vaccines have been proven to be the most effective medical intervention during the 20th century.
And you mentioned last week.
And they are safe, yes.
You mentioned last week in the first program that prevention is better than cure.
Right.
In America, we have a saying that an ounce of prevention is better than a pound of cure.
Yes, actually we have it also in our Arabic.
The Arabic saying?
Yes.
How do you say it in Arabic?
In Arabic we say it, dirham وقاية خير من قنطار علاج.
SubhanAllah.
Yeah.
Ajib.
One dirham prevention is better than 1 ton of cure.
Ajib.
Yeah.
Very good.
So our language is very rich, and our culture is very rich.
Absolutely. SubhanAllah. Ajib. Now,
so the other vaccines are not required because some of the vaccines are taken in a series of doses, and sometimes it can take
a long time.
2 months. Maybe
hepatitis
it can
is
extend.
One of them, right? It requires more than one,
extend to 6 months. So we recommend that people take their vaccine according to the vaccination schedule, and also the extra vaccines are recommended for some indications if they are indicated. Yes. But one thing we would like to emphasize regarding the vaccination is the validity of the vaccine. Because some pilgrims got the vaccines before and they think that they are immune. They have to watch for the validity of these vaccines.
It's 2 years, 3 years.
For meningococcal vaccine, the validity is 3 years. So if you take the vaccine in the past 3 years, you are okay. But if you are not sure, or if the period exceeded 3 years, you have to take it again. For influenza vaccine, the immunity usually is for 1 year. only for 1 year. I am talking about the seasonal influenza.
Right.
So people who got the vaccine before and they have some medical indications to take the vaccine, they should get it again. And for yellow fever vaccine, the validity of the yellow fever is 10 years.
10 years.
10 years, yeah. Yes,
hepatitis is also long-term, right?
Yes, hepatitis, they say that if the person took the 3 series of the vaccine, they will be immune for a long time.
Yes, more than 10 years.
Yeah, they don't need to take any booster doses except that they are working in some occupations
like
which
the
can
food industry.
Yes, food industry, healthcare workers,
barbershops.
Barbershops.
When they come close contact with
people.
Yeah.
Usually we recommend, a booster dose after 5 to 8 years.
Right.
But for the regular people, we don't recommend because there is immunologic memory. The immune system is very smart to recognize, and defend when we are exposed to any situation.
Well, Dr. Jamil, thank you again. Just as last week, we had to cut you off because you were just getting wound up. So we will continue next week and with our final episode and finish this talk about HAJJ and health issues. Dear viewers, please check us out next week for our last program. We always entertain your comments and questions. You can write me at P.O. Box 111, Sharjah Television, Sharjah, UAE. You can send me a fax at 9716-531-1969, or you can send me an email at medmanuae@eam.ae. And as our custom on Medicine and Islam, we conclude all our programs with a short dua, a prayer of the Prophet Muhammad, peace be upon him, such that if any errors or mistakes have been made on this program, and sometimes they are, and more importantly, if any sins are committed on this program, that Allah subhanahu wa ta'ala in His infinite mercy and grace will forgive us. Subhanallah wa bihamdihi, subhanakallah wa bihamdika, wa nashhadu an la ilaha illa anta, nastaghfiruka wa atubu ilayk. Jazakallahu khairan. May Allah reward you with the very best Islam. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Today is part 3 and our last and final episode in our 3-part miniseries entitled HAJJ and Health Issues. And the topic of discussion for today is the control of existing health problems on HAJJ. Control of existing health problems on HAJJ. Very happy and excited to have with us again Dr. Gamil, Tourky, who is Director of Preventive Medicine and member of the HAJJ Medical Mission for the Sharjah Medical District. Dr. Gamil, thank you again for coming.
Thank you.
Assalamu alaikum.
Assalamu alaikum.
And as usual, we cut you off before you can get finished in our program, so we're going to let you start off the day where you finished last week. But before we do that, some of our viewers may have missed our first 2 episodes, and it's very important that they know about the new guidelines for HAJJ this year because of the swine flu. So can you just summarize those new guidelines again briefly, and then we'll move on to today's topic. Bismillah.
Yes. This year, of course, is a unique because we now have this influenza H1N1 or the swine flu pandemic. And this is a disease which is transmitted by droplet infection, and overcrowding and comorbid conditions are some of the risk factors, among other risk factors. So I would advise, my brothers going to HAJJ this season to take the extra precautions in terms of their personal hygiene Also watching the environmental sanitation and making sure that they wash their hands quite frequently with soap and water, or they can use some alcohol-based, hand wash, and
sterilizers.
Also, yes, sterilizers. And also, when they have any flu-like illness or symptoms, they have to report to their medical team with Hamla, and this will minimize the possibility of transmitting the disease and infecting other people. At the same time, they have also to take care of themselves in terms of taking some rest. Don't overdo,
the ibadat,
yeah.
Take it easy.
So take it easy and try to get enough sleep, and also to have balanced diet, and to have to watch also for the food you are eating, because this, also can be a problem for some pilgrims.
You mentioned that the hamlas have to have an isolation room?
Yes.
Okay, now what's that about?
Yes, actually the Ministry of Health, there is a mandate for each hamla to have one room in their, residency facility to serve as an isolation room. So whenever, any Hajj suffering from flu-like illness, he can stay in this room, until the doctor come and take the, precautions. And if he needs treatment, he will start the treatment with him. And if he needs hospital transfer for any reason, he will also arrange. And also we ask the medical team in the Hamla to inform through a special notification form. We prepared to inform the medical mission. So we can conduct, some surveillance activities to make sure that the situation is under control, and inshallah everybody will be safe.
And you mentioned that the UAE also has special facilities as well?
Yes, also the UAE medical mission has arranged for special facilities for isolation, 200-bed facility in Mecca and 200-bed facility in Medina, and also the same thing in Minna.
SubhanAllah.
And beside that, we also will have like mobile teams. So from the medical mission, mobile teams equipped with everything will go on tours to visit all hamlas.
SubhanAllah.
So we will not wait people until they come to us.
You will go to them.
We will go to them
HAJJ.
to make sure that they are healthy, and they are following the instructions of the Ministry of Health.
Now, roughly how many hamlas do they have in the UAE?
Exactly, I'm not quite sure about the number, but they are...
Must be more than 100,
Yeah,
huh?
more than 100,
Yes,
of course.
easily.
More than 100, yes.
SubhanAllah.
But this year we have made the arrangement for 6 mobile teams to visit all these hamlets, because usually they are located in
together.
a very, confined area.
Exactly.
So it is easy to visit more than one hamla during the day.
Very good. SubhanAllah. Now, turning to other medical concerns, which is our topic of discussion today, the control of existing health problems. A lot of people go to Hajj and they got chronic diseases. They got diabetes, hypertension, chronic kidney disease, you mentioned liver disease, heart disease. Let's kind of go down the list. What are the concerns? Because diabetes is a big problem in UAE now. What about the diabetics that are going on Hajj? What are the concerns for the diabetics? Many
diabetics still can go and enjoy their Hajj. But we usually advise diabetics, as we mentioned in the last episode, to see their family doctor and to check their blood sugar and make sure it is under control. They don't have any complication. Because we know diabetes, if it is long-lasting, sometimes it can result in some unpleasant complications.
Absolutely.
And so by this checkup, the physician will, make sure that, the patient his diabetes is under control. This is very, very important. Also for diabetics, they have to watch for their diet. and also
It's kind of hard to do
yes,
sometimes when
and
traveling,
also
isn't it?
yes,
Yeah.
and also they have to watch not to be injured by climbing the mountains, or they have to be very careful.
They're prone to infection. aren't
yes,
they?
because we know that diabetics are more prone to infection when they get injured. And also we advise them to carry with them, enough medicine. So whenever they need the medicine, they will find it in their, at their,
And they should also have
yes,
like a one-touch or
right.
freestyle. Some
We
type of
usually
glucometer.
recommend, yes, and this is part of our education for diabetic patients, that they have to keep their blood sugar regularly monitored.
Yes.
We have these machines now which are very handy, and
Yes. Yes.
and they are very accurate.
And inexpensive
but
also.
yeah, it is not expensive, and many of the diabetics already they have it.
Absolutely.
So we advise them to have it with them. Even the medical mission can offer them blood sugar testing, but still they can do it twice a day, 3 times a day, just to make sure that their blood sugar is under control and it is monitored regularly. And they have to keep, like list of the readings. So whenever they go to their physician, a record,
yes.
so they can show them the level of blood sugar, since they arrive to the.
Now I have a personal question. I'm a diabetic.
Uh-huh.
And for 15 years, I was on oral hypoglycemic tablets.
Yeah.
And in December of 2008, they started me on insulin. So I've been on insulin now for about 10 months. Okay. Now the question is, most insulin requires refrigeration. Is there any form of insulin that when you're traveling on HAJJ, sometimes it's hard to keep your insulin, cool? Is there certain types of insulin you can take that don't require refrigeration?
No, usually we recommend to keep the insulin in the refrigerator.
Okay.
And they can. It will be available with the medical mission. They can take it from the medical mission.
Okay.
And also they can carry it in a small
container.
Ice box. Ice box. Where and this will only serve as a way of preserving the the insulin
ice or
for
ice
a couple
pack?
hours. Yes,
Right.
ice box with ice packs. Yes,
Right.
until they arrive, and usually they have the facility in in their hotel where they can keep this insulin.
Right.
Yes.
Okay, very
Yes.
good. I was a little concerned about that because, I have to go to Abu Dhabi sometimes because that's where my kidney transplant was.
Yeah.
And I have a little small ice pack I take with me to keep my insulin cold, and I also keep some things to take my medicine with. But I say I have my own car with me, and it's convenient. What about if I'm traveling on HAJJ? But I made
There are
HAJJ
some
before,
small
but I
ice
wasn't
box,
sick then. I wasn't
small
sick.
ice box,
Yeah, a
which
small
is
one.
not space occupying.
Right.
They can have one of these.
And ice is available everywhere, right? Ice
Yes,
is available.
yes.
Okay, very good. Now, what about some of the other diseases? What about the control of hypertension on HAJJ?
Yes, the same thing applies to all chronic diseases. We advise pilgrims to check if they know that they are hypertensive or they are on antihypertensive drugs. They have also to go and check their blood pressure before they go and make sure that it is controlled. Right. And also they have to watch their diet because they don't have to eat that much.
Now, this is one thing I
salt.
want to ask you about. This is the salt. The salt.
Yeah.
See, when you're on HAJJ, I mean, you used to be able to cook in a minute before they had the big fire in the tent. So they don't let you cook in a minute anymore, as I understand it.
Yeah.
So you have to buy food from outside. Now, most of this food is heavy in salt.
Yeah.
And also, a lot of it is heavy with rice, and rice, of course, is a big carbohydrate. But for diabetics, rice is not so good. So, how do you control your diet when you're traveling like that? It's kind of hard, isn't it? Or do you take some non-perishables with you, like some canned tuna and things like that? Or
yes, everything is available in the Holy Land, in Saudi Arabia. I don't recommend that we have to carry all the food with us.
Okay.
We are asking pilgrims also only to carry their medicine.
Okay.
Because
everything is available.
Yes.
Okay.
But for the
it's a long time since I made HAJJ. 1993 is 16 years. So I think things have changed.
Now the whole period of HAJJ is around maybe 12 to 13 days on average. So it is not a long time.
Right.
And I would recommend that they can eat fruits. and canned food, and make sure that,
Now, regarding the fruits, I read
but
that they should wash them because of hepatitis A.
Yes,
exactly.
Of course, we have to make sure that,
especially the fruits that where you eat the whole fruit, like grapes, pears, peaches, plums, apples,
any kind of food or vegetables.
Unless you have to peel it, like a banana or an orange, it's okay because you peel it.
Yes.
But if you eat the whole fruit, sometimes the food handlers have hepatitis.
Right.
And handling the fruit, the hepatitis can be transmitted through the fruit.
When we advise, taking
Wash
the fruits, we advise also to make sure that they are, washed correctly. And,
this is a very important point.
Yes.
Very important point.
Because not only for viral hepatitis, or
other
hepatitis A, for other diseases too. Because many of the, diseases we encounter during the HAJJ may relate to gastrointestinal system, like diarrhea, like food poisoning, like, this kind of, stuff. So personal hygiene, again, and environmental sanitation are very important.
Hand washing, fruit washing.
Yes. This
Wash
is important.
everything.
Yes, this is important. But my advice to any HAJJ with hypertension to check with his family physician before he leave. And also he has to watch his diet, and he has to make sure that he will not.
What about the water supply?
They can ask, the administrators in the Hamla to cook a special diet for them. It will be not a problem at all.
Exactly.
Yeah.
Exactly. What about
so
water?
they have to tell them that I am diabetic and I am
right.
hypertensive. I need salt-free diet.
Right.
Yeah.
Exactly.
Salt-free diet.
And you probably won't be the only one in the group as well.
Yes.
Now, water is also a concern, right? You
have to drink
water.
We know that there are so many diseases which can be transmitted through water. Which are called waterborne diseases.
Exactly.
And we have to watch for these waterborne diseases, especially during the HAJJ, because we know the overcrowding, and sometimes people are using common source for water like containers or, some plastic, containers which are not clean or something. Some people can use them in the, restrooms, and some people can use them for drinking some, so it
not good.
Yeah, so I would advise that
fresh bottled
when it
water.
comes to drinking water, it has to be, fresh bottled water.
Yes, absolutely.
Bottled water.
And the tap water in Saudi is not that good.
Yes.
Yes, I understand that.
Yes.
What about the Zamzam? No problem with Zamzam, right?
Yes, we have no problem with Zamzam.
Zamzam.
This is a medicine.
Yes, absolutely. And the opposite of diarrhea and vomiting is constipation. Now, some people, because they get dehydrated, they get constipated. Now, what do you do about that?
We usually, advise HAJJ to take enough water.
Okay.
Yes, and also to eat some vegetables and to take, for example, some cereals or some, fiber, which can facilitate.
And that doesn't go bad. I mean,
and also they have to keep the habit, because usually one of the main causes of constipation is when you change your habit, the timing, the place. This can contribute to constipation. You get nervous sometimes. Some. Psychological factors. So we have to keep the habit, and we have to be, on regular times.
Your routine should not change too much.
Yes.
Like I'm in a habit every morning of having some type of wheat bags of
and in case if we, have some problem with constipation, still we can take some laxatives.
Right.
Mild laxative. I would not recommend any purgatives or something which is drastic in terms of that. Yeah, because this can turn into
mild,
some
like Senna or something like this, or what do you recommend?
These natural, laxatives like the fibers we can take.
Fiber gel.
Milk,
Fiber gel. Milk. Okay, very good.
Yeah.
Stay away from the chemical stuff.
Yes, of course.
Very good. Now, of course, many people get infections during the HAJJ, especially diabetics. What precautions can you make to prevent those infections? We talked about it briefly, but we didn't go into much detail.
Yes.
We're just about out of time, so this is our last question.
Usually during HAJJ we are mainly concerned about upper respiratory tract infection, because these are the most common infections we can get from the droplet infection, overcrowding, coughing,
sneezing.
sneezing, spitting, these kind of, also meningococcal meningitis.
Isn't it against the
a
law
problem.
to spit in Saudi? Isn't it against the law to spit in Saudi and step in the garbage can? Isn't it against the law? There's a law against spitting, I believe.
I am not quite sure that
Yes,
there is
I
a law
think-
prohibiting spitting.
But
But,
it's supposed to spit in the garbage can, I think.
even
They
there is
give
a
him
law,
color for-
many people, violate this law.
Absolutely.
And
Yeah.
we Muslims, should be, more careful because usually we say there is, la darara wa la dirar, no harm or not to be harmed.
Yes,
So
exactly.
we have to watch our behaviors, our attitude, our habits, which
These are not
can
the
both
manners
some,
of the
yeah.
prophet, peace be upon him,
Right.
isn't it?
Yes.
Yeah, this is not. Unfortunately, thank you so much, Dr. Jamil. You've been with us for 3 weeks now, and you've made this year about HAJJ. This is very different from me. I've learned a lot from you. I'm sure our viewers have learned a lot, and we thank you so much. And we're going to see you back with some other programs dealing with preventive medicine.
Inshallah.
My dear viewers, we entertain your questions and comments. You can write me at Medicine Islam, P.O. Box 111, Sharjah Television, Sharjah, UAE. You may send me a fax at 976-5311-969. Or as most people choose to do, you may send me an email at medmanuae@eim.ae. And as our custom on Medicine and Islam, we'd like to conclude all of our programs with a short dua, a prayer of the Prophet Muhammad, peace be upon him, such that if any errors or mistakes have been made on this program, and most importantly, if any sins have been committed on this program, that Allah subhanahu wa ta'ala in His infinite mercy and grace will forgive us. Subhanallahi wa hamdihi, subhanakallahu wa bihamdika, wa nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk. Jazakumullahu khairan. May Allah reward you with the very best Islam.